Hi guys, my name is Dr. Pete Walimire. I'm here to talk to you a little bit about bunions. First, what is a bunion? A bunion is where your big toe goes off to the side toward the little toes, and this bone here, called the first metatarsal, gets way out of alignment, and it can create a big bump on the inside of your foot. It can make it hard to fit in shoes. So what a lot of people do is they try to put on a bunion splint and straighten their toe out. Guess what? It's never going to work. Some people will use toe spacers. Guess what? It's never going to work. The only way to fix this is with surgery. And we're going to talk about my 5 favorite procedures to fix this condition. So my favorite way to fix a bunion is called a Lapidus bunionectomy. That is where we address the problem at its root cause, at the first metatarsal cuneiform joint. We cut the joint perfectly, we rotate, we shift, and we put that bone right back in position, and we fix it with plates and screws. People have to wear a boot like this for about 6 weeks following that procedure, but it's okay to walk. You just can't walk a lot. Usually total recovery time is about 8 to 10 weeks, and that'll fix your bunion forever. My next favorite way that I like to fix bunions is through what's called a minimally invasive bunionectomy. We do that by making a tiny incision just on the inside of the bone here. We use a little burr to cut through the skin and up through the bone, and then we realign everything, put it back in place, and put a couple screws across it. This is hands down the fastest way to recover from bunion surgery. It's very long lasting, and we get excellent results with it. You still wear a boot like this for about 4 to 6 weeks until you can fit into a shoe. And once you're there, then your bunion should be fixed forever. And today we're going to talk about the Aiken bunionectomy. And Aiken is a bone cut in the toe bone. It's rather than cutting the metatarsal bone, we cut the toe bone. We can do that because the bone is curved over to the side sometimes. We can straighten that out, remove a little wedge of bone from the side, put a screw across there, and then that straightens the toe out. So we add that either to another type of bunionectomy procedure, or we can do that by itself and just shave down the bump a little bit. And it's a quick and easy way to recover from your bunionectomy. All right, this is day 4 of talking about bunionectomies. This one is really focused on not just fixing a bunion, but also addressing arthritis. And what we do is we fuse the big toe joint. So we take out all the cartilage, we straighten everything out, we put a plate and screws across that area, and that keeps that toe straight permanently. It also reduces all the motion. It can't bend and move, but we put it in the perfect position for you to still be able to walk normally, and it takes away all your arthritis pain. Today we're going to talk about a Reverdin osteotomy. Now this is not one that I do very often, but what we can do with it is very powerful. In some bunions, the articular surface of the first metatarsal, which is the joint surface, is angled way off to the side. And when we take that abnormally shaped bone and we straighten it out, that just makes that angle worse. And so what we need to do is make a small bone cut out here and remove a wedge of bone and straighten it out. And what that does is it keeps the joint perfectly straight. Your toe's not going to want to go back off to the side again. And we just fix that with a couple screws. It's very quick and simple. Sometimes we add it to another bunion procedure, but sometimes it can also be used as the primary procedure.